We're going to show you the platforms that we built for our niche practice. We are a women-based practice treating often pregnant women, most often pregnant women. When we treat pregnant women, we put them on this pillow. So when we add height like that, we have to account for that change with these platforms. Not to mention, we're all different heights. So all of us doctors operate a little differently because we're all different heights. We have two tables that are a little different in height. They're the exact same table, but this one's as low as it'll go. The other one is a little bit higher. Even with a table as low as it'll go, as low as they will manufacture it, it is still not the right height for us for all purposes, even without the pillow. So even if we're not treating a pregnant woman, it's really nice to have a change in height if we need it. Now, ideally, these would have wheels on them. That's maybe our next rendition, but for all intents and purposes, we have this for now. I built a few different renditions of this platform. This is where we ended up for the time being. There are a few reasons. Firstly, we wanted to be able to move these if we needed to, again, based on all the different heights in our office and what we're using them for, or if we need to move the table, we need to be able to move these as well. But I want you to be able to see what it looks like on the back side. It didn't originally look like this. Again, I've had a few different versions of this, but the way we ended it, or the way we ended up building it in the end, was with an angle here to kind of cut into the table with all of these pieces here. I originally built it almost as two boxes because I was able to then put the pieces together. These front pieces obviously match kind of the back pieces as well. What we did on this back side was we added a grit. So this is like a sandpaper sticker that we added so that it wouldn't slide, because what we found was when we were pushing off to treat, the board, the platform was going with us. So we had to put those down. And then on this side, we added kind of a matte platform. I don't know if you can see, there we go. That's the thickness. And then obviously this got painted so that it wasn't quite so visible, but it's like a mat, like a gym mat. We just glued that down. And then we put the foam edging around just to be careful of kids, because those hard edges are really tough with kiddos, and we have kiddos around all day long. And then again, as you can see here, we just slide it up against our table. And what's really nice, again, when we're on this, is we have plenty of space. So this was one of the things I had to really pay attention to when we were building it, was how wide we needed it, because you need a certain amount of width to be able to kick off or to be able to push against when you're treating patients, and then you need to be able to use the length of the table. So I might need to be here adjusting a patient, and then I might also need to be way low like this adjusting a patient. So we had to make sure that the length was correct for what we were doing, but then we also had to be able to move around the edges of the table. So that's the over-under on how we built this. And you will see more renditions as the years go on, but again, it has made a huge difference for us in what we do. So if you're even thinking about it, I highly recommend you do something like this in your office for yourself, because it will save your body. And at the end of the day, with us saving other people's bodies and helping them, we need to do the same for our own. So send us messages if you have more questions about these platforms, or you want to know, anything additional that we did that maybe I didn't talk about here.